Hello and welcome back to my YouTube channel. In this video, I'm going to share with you what I think is one of the most important tools that you can have in your health and wellness quiver. And this tool is an understanding of the best way that you can talk to your doctor. As many of you know, I'm really excited about the fact that we are entering a new era in medicine. And I believe that this era is characterized less by the patriarchal physician who sits and tells you what to do, and more by a very well educated and motivated, self-determined group of people who are really working in concert with their doctors to make the most beneficial changes towards their health. So in this video, what I want to do is I want to share with you how we physicians are trained. Because I think that when you understand how it is that we are trained to think and communicate, it becomes easier then to know how to communicate in turn with your physician. And while so much medicine can be done these days through tutorials, courses, and through products and testing which are accessible online, at a certain point you may need to sit down with your doctor and talk about modifying a medication dose. In this video, what I want to do is share with you the most efficient way to engage your doctor. And the best way to understand how to do that is to join me on a trip back into time on the very first day of medical school. And I'll never forget sitting in my classroom with 130 other super motivated students at the University of Colorado, and this was in 1989. And I looked to my right, and I looked to my left, and I thought, OMG, I am the least intelligent person in this class. Well, you have to realize that there were 129 other people going, is everyone else smarter than I am? So instantly what happens is you see that the population that makes up an entering medical school class is a very competitive group of people. And what happens is over the course of our medical training, we develop a language, and we also develop a currency, and that currency to a young medical student is knowledge. Now, don't get me wrong. I mean, I think that you want to have a physician who knows as much as is possible. But what happens is that our knowledge is really directed towards an allopathic style of thinking. And I had been an allopathic doctor for at least a decade when I decided to look it up in the dictionary. And it turns out that the term allopathy means the use of a medication or a treatment to counteract a symptom, and that's it. However, I feel that we are at an exciting time in medicine, because now in medicine we are learning that we don't just need to address a simple symptom, but more effectively we are learning that we can address constellations of systems. So I'll give you an example. Let's imagine you're going into your doctor's office and wanting to talk about your high blood pressure, otherwise known as hypertension. Now your doc is going to look at you and say, alrighty, let's put you on this medication and you're going to get a prescription. However, there's a new style of thinking, and whether this is called alternative, natural, complementary, or my preferred term with it, which is functional medicine, what we are learning is that there's a different way and different perspectives that we can look at our health. So when I look at a patient who is hypertensive, I'm thinking about their inflammatory state. I'm thinking about their stress, because that certainly drives hypertension. I'm thinking about what could be going on with their gut or possibly even their neurotransmitters. And finally, it's important to at least consider the possibility of a toxic exposure. All of these different things have been associated with hypertension in the past. And what's interesting is that you might know all of this and your doctor may not. So this is why it becomes a conflict to your doctor. So now, back to medical school. Our currency is knowledge. And many of you have seen, say, Grey's Anatomy, right? And you know the time on the show when they are in rounds. They're standing at a patient's bedside. Every doctor who has an MD after his name or her name has been through this scenario. And what it is it's a progressively more difficult set of questions which are put forth to the younger doctors by the leader or the attending physician. So there comes a time in every doctor's training when they run out of currency. In other words, the amount of knowledge needed to fully examine what is going on is out of their realm of knowingness at this time. I mean, this is why it's called a practice. It takes time to learn all these things. But what happens is that there develops a sense of defensiveness and a small defense of failure. In other words, in our mind, there's a small little voice that might be saying, how come that medical student knew the answer and I didn't? Or how come the attending doctor thinks that I don't understand how this disease process works? This is important because what happens is this ability to compete and to always know the most or know everything is what carries us on into our practice at a later time in our lives. So now imagine that you, having spent all this time studying to learn about what drives your physiology, your biology, your detoxification pathways, you name it, if you are going to sit down with your doctor in the doctor's office and bring up this knowledge, instantly that's going to put your doctor into a state of defensiveness, because it is quite possible that what you are sharing with your doctor is not within that doctor's realm of knowingness. So if you often go into your doctor and say, hey doc, I want you to do this and check this and check this, you're going to get this kind of a response. Why is this important? What I want to share with you is there is a set of language that you can use to optimize your healthcare, and it looks like this. So you go into your doctor's office knowing that he or she has been through this incredible experience of developing their medical knowledge, and that you might have understanding or knowledge of a topic that they don't. What I want you to do is to try this. Sit with your doctor and say, I'd like to offer that the two of us engage together on a journey. I would like to invite you to participate with me in my healthcare process. At which point your doctor might say, well, what do you mean by that? At this point, your response is to say, I've been doing a lot of reading and a lot of studying, and I know this is something that you may not have come across before, but I'd like to share this with you. And I'd like for us to work together to apply some of this thinking in my own health, my healthcare, my health processes. What this does is this diffuses any aspect which would potentially put your doctor at the defensive and give you this, as opposed to, tell me more, let's see what you've learned. Because we physicians want to take care of our patients well. So if you present to your doctor with an open expression of saying, let's work together on this, in a communal sense. If you go to your doctor and say, I've pulled some data off of the internet and some really good scientific papers, you're going to find that your doctor is more likely to engage in a process which is done with you, as opposed to saying, it's my way or the highway. This is one of the most important tools that you can have in your healthcare armamentarium. And while I'm making these videos to provide you a lot of information about all these different aspects of functional medicine, at a certain point you might need to sit and talk with your doctor, and I want you to do it effectively so that it benefits each of you. Once again, my name's Scott Resnick. I'm making these videos because I think you all are really smart. I think you want good information that you can apply to your own healthcare, and I think we're entering an exciting time in medicine when more and more of the healthcare is driven not by the patient with the patriarchal doctor sitting on the other side, but by a very well-educated, motivated group of health and wellness followers and medical healthcare consumers, which is you. So of course, if you like these videos, click, like, subscribe, comment. I'll respond to all your comments personally, and of course, share with your friends. And I will see you in an upcoming video.